All right, so you know how everyone's always talking about Medicare Advantage versus traditional Medicare?
Yeah, it's a big one.
It is. It's a big decision.
Hmm.
And people always ask, like, which one is better? And it's like, well,
It depends. There's no easy answer.
right. Like comparing apples and oranges sometimes.
Totally.
And it's your health. It's a big deal.
Absolutely. It's personal.
So we wanted to really dig into this. We've got some new research from Harvard and Inovalon,
Oh, yeah, I've seen this research.
and it's fascinating. They have so much data.
It's amazing what they have access to. Millions of patients, their entire healthcare journey.
It's huge.
Yeah.
And they're able to actually see, like, okay, what happens when people choose Medicare Advantage versus traditional and really compare them side by side.
And control for all those other factors that make it tricky. Like, are the differences because of the plan itself or because of the types of people choosing it? This data gets into all that.
Okay, so one of the things that jumped out to me right away was location. Like, you'd think healthcare is healthcare, right?
You'd think.
But where you live apparently makes a big difference in what people choose.
It's true. And some of the trends are surprising. For instance, people in rural areas, they're less likely to enroll in Medicare Advantage.
Really? That's interesting. Why is that? You'd think those lower premiums, all the extra benefits, that would be really appealing in a rural area where you might have less access to care anyway.
It is counterintuitive. Part of it's definitely about access to plans. Rural communities often just have fewer healthcare providers, fewer specialists, which means the plan networks can be much smaller.
Oh, that makes sense. If you have Medicare Advantage but can't find a doctor who takes it.
It defeats the purpose.
Exactly. It's like, what's the point?
Exactly. You're paying for something you can't even use.
Right?
It's like joining that fancy gym that's way across town.
Yeah. Sometimes convenience trumps the bells and whistles.
Totally. And, speaking of sticking with that's another thing that came out of this research. People really tend to stick with the kind of plan they had before.
What do you mean?
Like, if you had an HMO before Medicare, you're statistically more likely to choose a Medicare Advantage HMO.
Oh, interesting. So it's like, I'm used to this, I'm comfortable with it.
Exactly. Familiarity breeds, well, enrollment.
I guess it makes sense. It's like sticking with your favorite coffee shop,
Oh.
even if there's a cheaper one across the street. But we're not just talking about coffee here. This is healthcare.
Exactly. Big decisions. And, it's not just location and past experience, but demographics also play a role.
Like what?
Race and ethnicity, for example, they actually show some pretty significant trends in who's leaning towards Medicare Advantage.
Really? I wouldn't think that would be such a big factor. Everyone's 65 and over.
You'd think so. But the data tells a different story. Enrollment in Medicare Advantage is way higher among Black and Hispanic beneficiaries, and Asian beneficiaries too, compared to white beneficiaries. It's a pattern that we need to understand better, raises some really important questions.
Interesting. Okay, so we're seeing how your location, your past experiences with healthcare, even demographics, all these things playing into who chooses what. But the million-dollar question is, does it actually make a difference in your health and your wallet?
Absolutely, and that's where this research really gets fascinating. It goes beyond just who enrolls and looks at what happens after they enroll. And trust me, there are some real aha moments ahead.
So we've seen how where you live, what kind of insurance you had before, even your race and ethnicity, it all kind of plays into this Medicare decision.
It's all connected, yeah.
But let's talk about what really matters.
Yeah.
Right. Does one system actually lead to better health?
The million-dollar question.
Right. And let's be honest, a lot of people, they also want to know, what about the cost?
Oh, absolutely. That's a huge factor for folks. And, that's one of the big selling points you always hear about Medicare Advantage, right? That it saves money.
Right. I've heard that. But is it true?
Well, that's what this research really digs into, and the data gets really interesting. So they did find that people in Medicare Advantage, yeah, they tend to have lower healthcare costs overall, fewer hospital stays, fewer trips to the ER, all of that.
Okay, so it's true then.
Well, hold on, because here's where it gets a little tricky. We know that the people who choose Medicare Advantage, they often have different characteristics than those in traditional Medicare.
Right, like we were just talking about, all those factors.
Exactly. So are those lower costs really because of Medicare Advantage itself? Or is it just that healthier people are choosing it? You see the dilemma.
Yeah, I see what you're saying. It's like, how do you separate those things out?
Exactly. So to figure that out, the researchers did something really clever. They didn't just look at what happened after people turned 65 and joined Medicare. They actually looked back at the 2 years before that, when these folks were still on their employer plans.
Oh, interesting. So, like, Comparing apples to apples,
Yeah.
how did their healthcare usage change based on which path they chose?
Exactly. Smart, right. And this is where it gets really cool. Remember how we talked about that jump in healthcare spending that often happens when people first go on traditional Medicare?
Yeah, that 20% increase you mentioned.
Right. Well, for the people who chose Medicare Advantage, that jump basically disappeared.
Oh, wow. So it's not like Medicare Advantage makes you instantly healthier or anything.
No, no.
It's more like it prevents that initial surge in healthcare use that we see with traditional Medicare.
Right. They kind of just stay the course. And it gets even more dramatic over time. After 2 years, those in Medicare Advantage had 51% fewer hospital stays compared to a similar group in traditional Medicare.
51%. That's huge. We're not talking about like saving a few bucks on aspirin here. Those are major life-changing events.
Absolutely. And expensive events. And it wasn't just hospital stays. They also found a 22% reduction in ER visits for the Medicare Advantage group. So it suggests that, maybe the structure of Medicare Advantage is actually helping people avoid those really serious health issues down the line.
Okay, this is making me rethink things a little. It's not just about being cost-effective. It's potentially preventing those really big, scary health problems.
Prevention is worth a lot.
It really
Yeah.
is. But you mentioned earlier, there's kind of two sides to this efficiency coin. There's the savings with Medicare Advantage, but then there's also what you call the hidden costs of traditional Medicare. What did you mean by that?
Right. So we talked about that initial jump in healthcare use when people switched to traditional Medicare, that 20% increase.
Yeah.
Well, here's the kicker. It doesn't stop there. That increased utilization, it actually keeps going up year after year.
Wait, seriously. So even if you're relatively healthy when you first go on traditional Medicare, you're still likely to use more healthcare and potentially face higher costs as time goes on. Why is that?
Well, it's complicated, but the researchers point to a few key things. One is the lack of what we call proactive care management in traditional Medicare. Think about it. You turn 65, you might have different doctors for different things, maybe some pre-existing conditions you're managing. In traditional Medicare, it's pretty much on you to navigate all that.
Oh, so it's like being thrown into the deep end of the pool and told to just figure it out.
Exactly. Good luck. Now, contrast that with Medicare Advantage, where you often have a dedicated care team. These are folks who are proactively reaching out, coordinating your appointments, making sure you're staying on top of your health, connecting you with resources. They're like your healthcare advocates.
It's going to be huge for people, right?
Yeah.
I mean, healthcare can feel like a maze sometimes. You need somebody in your corner.
It makes a world of difference. And that's, probably a big part of why we're seeing those lower utilization rates with Medicare Advantage. A little hand-holding up front can save a lot of trouble down the road.
Interesting. Okay, so Medicare Advantage may be more cost-effective than we thought and potentially better for your health in the long run.
Hmm.
But let's be real, not all Medicare Advantage plans are the same, right?
Oh, absolutely not. It's a whole other ballgame trying to figure out all the different plan types.
Right. You've got your HMOs, your PPOs, zero premium plans, all this stuff. What did the research say about that? Like, how do those choices actually play out?
So when it comes to cost savings, HMO plans really came out on top in this study. Consistently showed lower utilization compared to PPOs.
Which makes sense, right? HMOs are all about that tighter network, more managed care.
Exactly. More proactive, more coordinated. But here's the thing. Even within Medicare Advantage, personal preference still matters. Remember how we talked about that familiarity factor?
Right. People sticking with what they're used to.
Same thing here. Someone might be more comfortable with a PPO, even if an HMO looks better on paper.
Because they're used to having more choices, more flexibility.
Right. So it's not one size fits all.
Definitely not. Okay, what about those zero premium plans we always hear about? Are they really too good to be true?
Well, they're appealing for sure, especially if you're on a fixed income.
Right.
And the data shows they're attracting a lot of people who have lower incomes, facing more socioeconomic challenges. So they're filling a real need there.
Yeah, that makes sense.
But you're right to be cautious. Zero premium doesn't mean zero costs, right?
Right. There's still copays, deductibles, all that.
Exactly. The research didn't really do a direct cost comparison there, but they did emphasize that these plans, they're playing a crucial role for a lot of people who might not be able to afford coverage otherwise. It's a complicated issue.
For sure. Okay, so we've covered a lot of ground here. I mean,
Mhm.
who knew that where you live, your background, what kind of insurance you had before, it all ties into this Medicare decision.
Right. And that Medicare Advantage is not just about saving money. It might actually be helping people stay healthier in the long run.
Which is amazing, right? Preventing those really serious health issues down the road, that's huge.
It is.
And at the end of the day, there's no one right answer. It's about finding the plan that's the best fit for you.
Absolutely. Do your research, know your options.
Be an informed consumer. It's your health, it's your future. So thanks for joining us for this deep dive. Until next time, stay curious.